Hi, I'm doing my discussion board over the ABA Inside Track episode 214, Compassionate Care with Dr. Mary Jane Weiss and Dr. Jessica Rower. So these professionals are doing research about compassionate care within the ABA field. It's newer for the ABA field compared to, I guess, psychology and speech pathology and some of the medical, maybe educational fields. Um, so they look at a lot of different literature. They talk about how to fuel being compassionate. They are researching that. They did a year of conversation research and for authenticity responses. Some people, they attempt to be authentic and compassionate, but it comes off as condescending or dismissive, that they have found in literature from other professionals. They have to know the difference between what is empathy and compassion. Compassion is known as the intention and or the action. There is a checklist to teach the skills that start with a call to action they spoke about in this, and you have to test it out. The impact of the approach measured with parent stress levels is one that they mentioned too that they haven't seen. And so compassionate care is full of soft skills, and it looks like they have to figure out how to measure this. I believe that the authenticity and responses are the most important part of being compassionate, but there is a lot more research to be done on this, but pulling it from these other fields will really help too. And they did talk about collaboration, which was actually the previous discussion board episode that ABA episode that I spoke about. So a lot of this stuff goes hand in hand, so we can all work together and achieve what we want our end goal to be, which this episode is compassionate care. So I would suggest that it would be good research to look into to make sure that you are being genuine when you are in the classroom or whatever profession you're going to do, and do refrain from seeming condescending or dismissive in any way, especially I would say when it comes to parents, because they need to know that they have a choice and they should be heavily involved in their children's education, and they shouldn't feel that you as the educator is the authority figure and just what you say goes all the time, because they also know their children, and working together, collaborating, being compassionate, understanding for the student and their families is very important too. All right, thank you.